Team USA is training hard and ready for the Olympic Games. And so is Jacob.
Whoa, I've got my Lucky shirt and Xfinity Flex.
Oh yeah, Jacob's family got Xfinity Internet with the best Wi-Fi for their home and a Flex 4K streaming box free, plus Peacock Premium included. So Jacob is ready for anything.
Go Team USA!
With medal ceremonies, highlights, interviews, and more, plus all his favorite streaming apps in one place.
Can your internet do that?
Restrictions apply. Not available in all areas. Peacock subscription required.
Xfinity, proud partner of Team USA.
This is a CBC podcast.
Yesterday, we heard Mari Agnew's story, the 20-year-old woman's experience trying to get care for her ongoing abdominal pain exposed some big gaps in our healthcare system, particularly for women. We heard how Agnew had no choice but to pay out of her own pocket to see a gynecologist at a private clinic in Moncton. And we heard how this private clinic is seeing a growing number of women, many who don't have a family doctor. Vanessa Blanche has been looking into the rules around doctors who bill patients directly and the issues this raises. And she is back again with us this morning. Good morning.
Good morning, Donna.
First of all, is this allowed, a doctor charging a patient directly for care?
I know it sounds completely out of step with the way we think about our healthcare system in Canada. But the short answer is yes, it is allowed. Dr. Ed Schallenberg, who speaks for the College of Physicians and Surgeons of New Brunswick, says doctors can bill patients directly for care. Greg Marchildon teaches at the University of Toronto. He's the Ontario Research Chair in Health Policy, and he says it has always been possible for doctors to practice outside of the public system.
In virtually every province, doctors are permitted to opt out of Medicare. That's their choice. But if they do so, they do not have a Medicare billing number and they're not given one. And that means they can't bill the public system, and any patients they take in have to agree to pay completely privately. And this is legal under Canadian Medicare, but of course, very few members of the public would ever agree to do that. And therefore, these kinds of opted-out practices are generally only exist in the very biggest centers. And the whole idea is to keep doctors either in the public side of the street or the private side and not to mix them.
Now, Jonna, Marchildon says the ability to opt out was meant for things like cosmetic surgery, things that aren't medically required. It was never intended to apply to medically necessary primary care services like a gynecologist. And he says if doctors are making that move and patients are willing to pay, you really have to ask yourself why. What is going on here? All
right. So what about this gynecologist who decided to offer services at the private Moncton clinic? Why did she make that move?
Well, Karen DeRosier, Dr. Karen DeRosier, she's been very open about how she ended up working one day a week at this private women's clinic and charging patients directly. She actually had her own practice in Moncton as an obstetrician gynecologist for years. She had a Medicare billing number. She was part of the public system for more than a decade. But in 2015, she made the decision to give it up.
Had a burnout, I won't lie, had a burnout and depression in 2015. So after that, I had to rethink of how I want to work because I have a hard time to say no to patients and people. But yeah, it's part of the demand and the calls. And as you get older, it's not as easy to work 24 hours and bounce back the next day and keep going. So that was part of it. And my husband is a neurosurgeon, so we had two busy practice, and I had 3 kids. And but you know that if you stop, then your colleague will have to see your patient. They're already overloaded. They're already working like crazy too. So I was like, I can't stop. But in the end, I got worse and worse, and I had no choice to stop at some point.
Now, since giving up her billing number, DeRosier has been filling in for her colleagues when they need to take time off. And she's also working part-time at a family planning clinic and at the private women's clinic in Moncton, Reconnect, and another one that's called Sparkle.
So what do other doctors say about that, Vanessa? I mean, it must raise concerns, especially in a province where we already have a shortage of doctors and specialists.
It absolutely does. I talked to Dr. Jeff Steeves, who is president of the New Brunswick Medical Society, and I asked him, what does he think about this move by Dr. DeRosier?
You know, if we lose a physician from within the system, then I lose a colleague that I might need their help and to refer to within the system. So the concern would be if the private system were to grow, then, you know, that would be more challenging for the physicians left within the system. This was a big issue in Britain 20 years ago in the national health system, where their private system was getting larger and larger and larger because of the inefficiencies of their public system. And when they had some major changes to improve the efficiencies within their system, the private system basically disappeared. The need for it evaporated.
Now, John, I also spoke with family doctor Daniel Reza. He chairs a group called Canadian Doctors for Medicare, and he says this is concerning because when you have doctors exit the public system, you're actually making wait lists longer for everyone, not shorter. He says the reality is that doctors who charge privately are seeing the wealthier and healthier patients, and they're sending the more complicated cases back to the public system. The term he uses to describe this is you are privatizing the profit and socializing the risk. He says others call it cherry picking, but whatever you call it, Dr. Reza argues you are degrading the care in our public system.
But what about the patients who say they don't have any other options and who are willing to pay?
Right, and that's exactly the point Reza Deber, a professor at the University of Toronto, made to me. Her opinion is that when you have doctors providing medically required care outside of the public system, it's a warning sign of a major shortage of doctors, because why else would someone pay privately for something you can get publicly? And that's exactly what Dr. Desrosiers told me. In New Brunswick, we have a shortage of family physicians and specialists, and it's causing big problems. Doctors like her are burning out, and patients just can't get care.
Yeah, we've heard about that shortage, of course, especially for family doctors. In December, there were more than 44,000 New Brunswickers waiting. What did Dr. Desrosiers say about that?
Well, the question I asked her was, does New Brunswick have gaps, in particular in women's health care, and are there enough gynecologists right now? And this is what she had to say.
We need more, honestly. The thing with gynecology is we are obstetrician gynecologists. I think almost everybody in New Brunswick do both of practice. So we have to provide care to pregnant women, which we don't have a lot of control of how many pregnant women we have to see. So if you have a lot of pregnant women, then you have less time to see the gynecologic care. And there is a lot of referral for gynecology. So it's really hard to be able to answer all those demands. But there is a gap in many specialty and in family doctor practice as well. So many patients that I'm seeing that have no family doctors. If you cannot see a family doctor, how do you get your referral? So they end up sometime in Emerge, and then ER say that there's too much patients going for no reason, but they have no family doctor to be able to refer them to gynecologists. So it's like a big circle of things not going well.
Dr. Desrosiers says it's sad, but it's the reality right now in New Brunswick, a big circle of things not going well. And I will add, Jonna, that Dr. Desrosiers told me Mari Agnew's story that we heard yesterday is not unique. There are other patients she sees who tell her their family doctors are not comfortable with Pap tests or other gynecological care.
Wow. So what are patients supposed to do? I mean, few family doctors, walk-in clinics that can only provide some care, and ERs that are packed.
Well, health policy professor Greg Marchildon says this opting out of the system by doctors was never intended for those providing medically required primary care. And he says this business in New Brunswick, where patients are waiting for years to get a family doctor, just shouldn't be allowed. Marchildon says this is contrary to the Canada Health Act, and the federal government would have the right to withdraw transfers to the government of New Brunswick for the amount that would be charged. So I asked him, what should a patient like Mari Agnew do when you can't get the primary care you're entitled to as a Canadian resident?
Number one, they should immediately write a letter to the minister setting out their situation, and they should, in the letter, be demanding that the service be provided. The government can't get out of it by simply saying there's no family doctors available. The government then could make an arrangement with doctors or a clinic in another province, or it should set up immediately its own clinic, publicly paid doctors or a nurse practitioner, and provide that service. But it's got to provide that service, right, one way or the other, and it can't hide behind the fact that the service is not available. It's got to make it available in one form or another, or they're subject to deduction under the Canada Health Act.
And I have contacted New Brunswick's Department of Health multiple times asking for information on the lack of healthcare services for women and these other issues, but no one has been made available.
And I understand there's more to this story, Vanessa?
Well, yeah, later this week I'll be back, Jonna, to tell you about one more challenge I discovered in our healthcare system. This one has to do with the nurse practitioners and other healthcare providers who are seeing patients outside of the Medicare system and charging them. Now, until this month, they were able to send patients to the hospitals for medically required lab work or diagnostic tests. But as of April 1st, the Department of Health is going to charge those nurse practitioners and doctors for those tests. Of course, the question is why, if the tests are medically required and the patient has no family doctor or nurse practitioner as part of the public system, why are they being penalized? So we will take a closer look at that one.
Okay. Thank you.
You're welcome.
That's Vanessa Blanche. She's a CBC reporter based in Moncton. If you have
For more CBC podcasts, go to cbc.ca/podcasts.